According to the Centers for Disease Control and Prevention, 40% of American adults have reported struggling with their mental health and substance use in late June of 2020, the time that COVID-19 cases were gradually rising. This indicates that there is an increase of stress, anxiety, depression, and even thoughts of suicide. Are these same numbers present here in Laredo? What about students in high school or college? Is there a way to improve their mental health? That's where research comes into place. Hello, my name is Raquel Puig, and my research topic is on teen mental health during the COVID-19 pandemic. As we already know, coronavirus disease 2019, or COVID-19, is a novel coronavirus that was discovered in Wuhan, China in November of 2019. Once the virus slowly became more susceptible towards the public, the World Health Organization began to implement safety protocols to prevent further cases. These protocols included wearing a face mask when going out to public, constantly washing your hands, and staying at home as much as possible. By March of 2020, the world had completely shut down. When acknowledging mental health, stress is a feeling of emotional or physical tension. Another mental health challenge is anxiety, which is a feeling of worry, nervousness, or uneasy, typically about something with an uncertain outcome. Lastly, depression is a mental health disorder characterized by a persistent depressed mood or a loss of interest in activities, causing a significant impairment in daily life. With this information in mind, it is important that we evaluate our public's mental health, especially among the youth of Laredo. Combining the information regarding COVID-19 and mental health, I plan to examine how high school and college students are feeling throughout the entirety of this ongoing pandemic. The purpose of this study is to analyze the mental health challenges, which are stress, anxiety, and depression among high school and college students here in Laredo, Texas, due to the COVID-19 pandemic. I will evaluate the current status of the students' mental health from the beginning of quarantine to present day, and conclude if their mental health has improved or worsened. Lastly, I will evaluate different coping mechanisms to assist those with severe mental issues during these difficult times. As previously stated, participants of the study will include students between 14 to 24 years old and will be enrolled in a high school, college, and/or university here in Laredo, Texas. To conduct my research, I will plan on creating surveys that question the students' mental health status by using the browser SurveyMonkey. I will also use the Statistical Package for Social Sciences software, or SPSS, to collect my data and create a statistical analysis chart of the students' responses. Since I am involving high school students, I will provide a parental consent form to any participant that is under the age of 18. To ensure their confidentiality, participants will not include any personal information in the surveys, such as their name, phone number, email address, home address, etc. If the COVID-19 regulations are still in place by the spring 2021 semester, I will ensure that the participants complete the surveys online to prevent any person-to-person contact. I would like to thank the LEAPS program for granting me this opportunity to research a topic that I will find very beneficial to our community. I would like to thank Dr. Garza, Ms. Agüero Riojas, and Ms. Solis Cavazos for allowing me to participate in this program. Lastly, I would like to thank my faculty mentor, Dr. Laura Lopez, and my student mentor, Sonia Ortiz, for assisting me throughout the entirety of my research project, along with helping me perfect it in the best way possible. If you would like to see where I based my research off of, you can examine these sources to look at different data and conclusions different researchers came to in their research. Thank you.